If you've got back pain, you might have come across Stuart McGill's Big 3 exercises in the past. And these are often given to people as a magic fix-all for back pain. However, in my experience, they're not always all they're cracked up to be, and there's a big reason why they might not be fixing your back pain. So in today's video, I'm going to reveal what that reason is and the other things you need to focus on that should help you with your back pain instead. If you don't know who I am, my name is Harlow. I'm the Over-50s specialist physio here at HT Physio in Farnham. And today we're going to be revealing why the McGill Big 3 might not be fixing your back pain. Now, Dr. Stuart McGill is a back pain researcher and a professor who's from Canada. And basically he's done tons of research into how to use core strengthening to improve your back pain. And he's written a book called Back Mechanic, and inside that book he recommends 3 exercises which he calls the McGill Big 3. You can see them on the split screen at the moment. That's me demonstrating them. And these exercises have been shown in the research to provide a huge amount of core stability when they're done repeatedly. They do really strengthen the area around the midriff, and they can provide great stabilization for people with back pain. Now, the problem with the McGill Big 3 is that I feel that on their own, they usually aren't enough to fix someone's back pain. I'm going to explain why in just a moment. But before I do, I just need to say that these exercises are not bad. I like them. I think they're good exercises. I recommend them a lot. I even recorded a video showing you how to do those exercises correctly. It's just I feel that on their own, for most people, they're not enough. And I can think of 8 other causes of back pain that are not going to be solved by the McGill Big 3 exercises. And all 8 of these problems are not necessarily types of injury, they're drivers of pain. So they're mechanical problems that can lead to back pain that aren't fixed by core strengthening. Let's have a look at those 8 reasons. I'm going to show you what they are, and hopefully that will give you some clues as to how to fix your back pain. To illustrate this story, I want to tell you about a patient of mine who's a gymnast. And she came to me, she's in her 20s, and she's super flexible and super strong. Now, she came to me because she says, I've been doing gymnastics for years. Over the last year or so, I've been developing this lower back pain and I just can't solve it. I've been doing loads of exercises. I do all my core strengthening as part of my gymnastics routine, but the back pain's not going away. And when I tested her, she had one of the strongest cores I've ever seen, but she still had the back pain. So the tight, strong core did not prevent back pain in her circumstances. She had great stability over here, but she still had the back pain. So core weakness is not the only cause of back pain. Here are 8 more causes. So the first cause I can think of that causes a lot of lower back pain is weakness in the glutes. The glutes are these muscles here. They're super important when we bend and when we twist. They work in conjunction with your back muscles. And if the glutes are weak, then the back muscles have to work twice as hard, which means they start to get tighter and tighter over time, and then that can trigger back pain. So having weakness in your glutes, particularly your upper glutes, gluteus medius and minimus, can be a huge driver of lower back pain, and those aren't fixed by the McGill exercises. The second cause of back pain is tight hip flexors. And your hip flexors are your muscles that live at the front of the hip. So my hip flexors go from here down into the leg. We do actually have one that comes right up through the stomach and attaches to the spine. And if your hip flexors are tight, usually from lots of sitting, we start to get this happening, which is an anterior pelvic tilt in a person that looks something like that. And that's because the hip flexor that attaches near the top is being pulled down towards your leg, which puts you into this kind of position and jams together all of the facet joints at the back of the spine here. So they go from here to here, all squashed together, and that can be a big trigger of lower back pain and cause tightness in the back here. Now, just strengthening your core can help to bring the pelvis back into a normal position, but it won't release those tight hip flexors. And that's another way that the 3 McGill exercises fall short. Before we go any further, I just want to tell you about a very special bonus I've created for viewers of this channel. It's called the Complete Guides to Building Muscle and Strength over the age of 50. And if you're someone who is a little bit confused about how to go about starting the process of building muscle and strength, you don't know what equipment to use or what exercises to choose, this is perfect for you. It's an exclusive 25-minute video that you can't find anywhere else, where I teach you all the ins and outs of building muscle and strength specific for people over the age of 50. So it's one of the best things I've created. I'm giving it totally for free to viewers of this channel. All you need to do is scroll down below this video. There's a link in the description where you can sign up. I'll send you the video straight away and you can get started. It's some of my best info, and if you use it, I hope you enjoy. The third cause of back pain that's not addressed by these exercises is tight hamstrings. So your hamstrings live at the back of the thigh. If they're tight, they do the opposite. They pull your pelvis underneath you like this. And you can sometimes see people walking around like this. We call this a sway back. They often have very tight hamstrings, and that pulls on the pelvis and can lead to mechanical stress on your back as well. Now, going on from that, another cause of back pain are tight quads. So tightness here at the front of the thigh, very similar to your hip flexors. Actually, one of your quads is a hip flexor. So if these are tight, it pulls your pelvis forward like this. It also restricts you on this kind of backwards movement here when you're walking, which again puts stress on the pelvis and the lower back, and that can lead to problems. As well as being weak, your glutes can also be tight, and tight glutes can cause back pain as well. This was actually a problem of mine. I had pretty tight glutes at one point, and I was walking around with quite a bit of nagging in my lower back. So I was stretching my hip flexors, not really much was happening, stretching my hamstrings, didn't really improve it. I stretched my glutes just once or twice, and bam, the back pain almost went away straight away. And this is because, again, your glutes are here, they live on the pelvis on both sides. They also have some attachments to the sacrum, so if they get tight, they do pull the back into a funny position, as well as affecting the alignment of your leg. So tight glutes can be another driver of back pain. Now, we haven't actually spoken about the back at all. It's all been the things that attach to it. But another cause of back pain is poor range of motion in your spine. So let's say that you can only bend forward to here. If you ever went down to here by accident, just because you strained a little bit too far, that's going to really hurt. Whereas someone who can normally get all the way down here, they're going to have no problems. So if you're stiff in your lower spine, your joints aren't moving properly, maybe you've got some arthritis in there, which means that you've lost that flexibility, again, that can lead to back pain. And because the McGill exercises are only about stability, not flexibility or mobility, again, we're not going to see huge improvements if that is your problem. Another big cause of lower back pain is an oversensitized nervous system. And this is particularly the case for people who've had back pain for a very long time. Now, the brain is very clever. It learns movement patterns that have caused us pain in the past. So let's say I've had many times where I've bent forward and bang, my back's gone. Now, if that happens 3 or 4 times, your brain starts to paint a picture of that movement being dangerous. So every time you go to bend forward, basically everything's on red alert. The nerves are hypersensitive, the muscles are right on the edge of a spasm, waiting to lock up to try and protect you. And that means because you're so sensitive to movement, any movement can trigger a spasm and cause back pain. And we see this a lot. It doesn't necessarily mean there's a big injury in the back. It's just the back is oversensitive. It's hyper alert to any kind of danger. Now, the McGill exercises can help with this kind of problem, but I found a more effective approach to that to be just very slowly reintroducing that range of motion in a really safe way. So let's say someone has trouble bending forward every time they do that when they're standing, bang, the back locks up. I get them sitting in a chair and just practicing 6-inch forward bends and coming back up. Now, doing that kind of thing can be super helpful for desensitizing the nervous system and getting their range of motion back. The last cause of back pain we're going to talk about today is a genuine injury that hasn't yet healed. Now, if you've got a disc bulge, or you've got a herniated disc, or you've pulled a muscle in your back, or you've just overstretched a ligament in your back, or you've aggravated a tendon, then all of those things are physical injuries that need to be given time and space to heal. And sometimes, if it is just a minor injury, they just need a few days of relative rest. So you're still active, but you're not trying to do anything strenuous for your back, and that will give it time to heal. So that's a completely separate reason for your back pain not yet getting better. Now, in the case of disc bulges or herniations, they can take a long time. And it doesn't mean that you should be resting that whole time. You should be working around the injury. But this is why I say that it's very important for back pain exercises to be non-painful, because then we know we're not aggravating tissues that are already damaged, and we're giving them the time and space they need to heal. Now, in those instances, if you have a genuine injury, I like to follow a pretty typical regime to get that better. It's about improving the range of motion first, very, very slowly, reintroducing some of the strengthening exercises to build up strength around those target areas, and then finally getting that person back to doing the things they were doing before the injury. Now, if you just did the McGill exercises, you're only ticking off probably half of one of those points. You're getting the core strong, but you've neglected the glutes, you've neglected the mobility, you've neglected flexibility, and you've neglected slowly reintroducing the things that cause the injury in the first place. So it's an incomplete approach. So anyway, I hope that kind of makes sense. I'm not trying to bash the McGill exercises. I think they're really, really good. I just feel that we need more as a complete package to help people with back pain. Hopefully that's given you some idea of the things I look for in my patients, and it can give you some clues as to how to fix your problem too. So that's the reason why the McGill exercises on their own are not likely to fully fix your back pain, and hopefully given you some signposting as to what to do instead. If you found this video helpful or useful, please do leave a comment below or consider sharing it with a friend or a family member, because that's how this channel grows. We don't pay for advertising or anything like that. It just grows through word of mouth and on YouTube organically. So if you like what you see, please do share it and let us know your thoughts below. And if you want to get more from me, then you can pick up a copy of my book. It's called Thriving Beyond 50, and you can find it on Amazon using the link below. It's got loads more exercises and tips for improving back pain, and it will show you how to do the things that we've discussed in this video. Anyway, thank you so much for watching. I really appreciate your time, and I'll speak to you again on the next one.